Welcome to the Virtual Hammer Museum, coming to you live from Los Angeles. I'm Claudia Bester. I'm the director of Hammer's public programs, and I'm pleased to welcome you to today's Hammer Forum on workers' rights during the COVID-19 pandemic. Tonight, we have a really great panel for you with former Vice President of the UFCW, Robin Williams, Filipino worker organizer Aquilina Soriano, Berkeley labor specialist Kent Jacobs, and our moderator tonight is Jessica Levinson. Before we get started, I have a few notes for the audience. This program is being conducted via Zoom webinar, and in the Zoom webinar, we cannot see you in the audience and we can't hear you. We can just see your names and anything you type into the chat box and in the Q&A box. So we'd love for you all to introduce yourselves in the chat box and tell us where you're tuning in from. The chat is also an area where the audience can all talk with each other. And the Q&A box is where you type in questions you have for the panelists, and it will help if you specify who the question is for. So remember, Q&A, questions for the panelists go into the Q&A box. Discussion with your fellow audience members go in the chat. And please note that this program is being recorded and will be available later on the Hammer website. Also, if you want to receive reminder emails about the upcoming Hammer events, please sign up for our email list on the Hammer website, where you can also find recordings of our past public programs as well. So on to today's program. The Hammer Forum is a monthly series of public discussions about current social and political issues, and it's made possible with support from the Rosenblum family. In today's forum, we're going to talk about the challenges facing U.S. workers today. Health and safety is, of course, at the forefront of everyone's minds during the pandemic, so we're going to discuss that, of course, for the people who are out in the world working right now, as well as for the people who will soon be going back to work. We'll also talk about pay equity for essential workers and the conflicts that they face when forced to choose between working in an unsafe environment or feeding their families. United Farm Workers tweets on their Twitter feed, which I think is amazing. They tweet a photo every single day of farm workers picking the fruits and vegetables that feed us. And I really, really love it. I highly recommend following them. It's a great reminder of the people who are doing this important work that keeps the rest of us fed and healthy. And they really lay the foundation that makes it possible for everyone else to even exist and move forward. So I am really grateful to the people who grow and pick our food, and to all the other essential workers out there, without whom I can't even imagine how life would be possible. So that's what we're going to talk about tonight. We have some wonderful guest speakers tonight who I really admire. So I'm going to briefly give you a little background on each of them, and then we'll get started. First, we have Robin Williams from the United Food and Commercial Workers International Union. The UFCW is the largest private sector union in the United States, representing 1.3 million workers in grocery stores, meat packing, food processing, retail shops, and other industries in all 50 states, Canada, and Puerto Rico. Robin started out as a grocery store worker in Washington, D.C., and became an active union organizer as a safety coordinator. Later, she helped organize nursing home workers in Maryland, and in 2003, she coordinated the Immigrant Workers Freedom Ride, which brought together tens of thousands of immigrant workers and immigrant rights activists in a tour throughout the United States to demand respect for workers' rights. In July 2015, she was elected International Vice President for the UFCW International. She's now on the board of the NAACP and the Coalition of Black Trade Unionists. And while she officially retired from the UFCW 5 months ago, she's still tirelessly working for workers' rights. And I believe this is the third public speaking engagement she's had today alone. So thank you to Robin for doing another one today. Aquilina Soriano Versoza is a founder and current executive director of the Pilipino Workers Center of Southern California, which is a nonprofit serving and organizing the low-wage Filipino immigrant community in Los Angeles. She's also serving as the president of the board of directors of the National Domestic Workers Alliance, and she was a recipient of the 2018 Frederick Douglass 200 Abolitionist Award. Ken Jacobs is the chair of the UC Berkeley Labor Center. His areas of specialization include low-wage work, labor standards, policies, and healthcare coverage. He has recently worked on economic impact studies of proposed minimum wage laws for the cities of Seattle, Los Angeles, and San Jose, and conducted analyses of the public cost of low-wage work. He works with stakeholders and policymakers with research on the effects of the Affordable Care Act and other ways to provide healthcare services to the remaining uninsured in California. And he consults for Covered California on issues related to implementation of the Affordable Care Act. Our moderator tonight is Loyola Law School professor Jessica Levinson. Levinson studies the law of the political process, including election law and governance issues. Her work focuses on ethics, political corruption, voting rights, campaign finance, ballot initiatives, redistricting, term limits, and state budgets. She regularly appears as a legal and political expert on television and radio and in print. She's the co-host of the new podcast, The Legal Eagle Files, and has a weekly legal segment on the Los Angeles NPR station KCRW. She's also an op-ed contributor for NBC.com and the associate director of Loyola's Journalist Law School. Professor Levinson served as the president of the Los Angeles Ethics Commission until 2018. She's also the founding director of Loyola Law School's Public Service Institute, which is dedicated to creating the next generation of leaders in government service. So hello and welcome, Professor Levinson.
Hello, there you are. And welcome to everybody else for joining us. Thank you so much for being here. But Claudia, before you completely disappear, thank you so much for allowing me to be part of this. This is one of the panels that I think is nearest and dearest to our heart, in the sense that when we started talking about how to do these hammer forms in the era of a pandemic, we started talking about the issues that are most important to us. And really, kind of the way we talked about it was our health and safety and what's happening to American workers. And so that's what we're going to address today. I want to start really very broadly talking about the place of American workers in our society today, and then go in a little bit more detail talking about how COVID has affected that situation. And so my main goal is for you to see not that much of me and a lot of the panelists. So with that said, I want to just call up one slide, or I'll call up my first slide. And that looks like an MP3, not the slide, at least to me. So maybe we can pull that down for a minute. And instead, I'll just tell you what I had planned on talking about. So, or what we will talk about, excuse me. Oh, there it is. Workers' rights during a pandemic. As I say to my students, I hope you're all in the right room for this class. Let's call up the second slide. And this is basically what I want to talk about today, and it doesn't have to be in this order. But first, what are the biggest problems facing American workers even before COVID? Where were the big cracks in the system, and how has COVID exacerbated those cracks? Next, I actually think I want to talk about the third heading, which is what protections do we have in place for workers? I want to put a little asterisk there. We're going to talk about undocumented workers as a separate category because some of these protections might not apply to them. I want to talk about things like health insurance, unemployment insurance, unions, and then what does it mean to be an essential worker? What's our definition? Who typically makes up this group of people? And then talk specifically about the big categories of people who frankly are helping us live our lives right now during the time of a pandemic, and who are, I think at this point, we would acknowledge pretty essential, but maybe not being treated as such. Let's take up pretty essential and just say essential. And then finally, I want to end with what can we do? And this is something that I get asked a lot, but I want to end with what can everybody listening do? What's one step we can take tomorrow? So with that, let's take down the slide. And let's bring in our panelists. I'm so excited about this particular group. And as I said to them, I think that the best hammer form is going to be a conversation where I hope you feel like you were at a dinner table and we had a really fun but educational conversation. So welcome. As I said, the first thing I want to talk about is like the 30,000-foot view of this, which is first, let's start in pre-COVID times. And Robin, if it's okay, I'm going to start with you and say, what were the biggest, let's pick three. What were the three biggest issues facing American workers on February 20th, let's say.
Right. So again, let me just say thank you for inviting us to be on tonight. And I want to correct one thing that Claudia, when in her introduction to me, I wasn't the national coordinator for the Immigrant Freedom Ride. I was one of the main coordinators for the United Food and Commercial Workers Union. And so it was really my first experience with, really doing this work around immigrant workers across the country. And so it was very eye-opening. I was practically like new to the labor movement. I worked in the grocery store for 13 years. And so, was very comfortable, with being with other workers. So let me get into your first question. So, prior to COVID becoming really exposed, because we kind of heard about this virus in February, right? American workers already faced problems. One, when we look at what we call essential workers now, many of them are in low wage jobs already, right? They're in jobs that have health and safety issues, prior to COVID. I didn't see meatpacking and processing on the list, but look at meatpacking and processing plants where many are immigrants, but we also have, African Americans work in that industry. We already have health and safety problems there. We have healthcare disparities in these companies where, we have to fight with the companies all the time to make sure that, workers have sick leave, adequate sick leave, where they have health care and they don't have to, pay a lot of money out of pocket. So there were already issues in the system. And when you talk about workers of color, there are already, disparities anyway, right? Racial disparities in the industries. And then when these workers go back to home, many live in overpopulated communities. We had and last August, we had a big raid with meatpacking plants, right? The UFCW, me being one of the leaders on the ground, organizing to help, those immigrant workers that, were displaced out of work because ICE came in and raided 600 workers between 8 meatpacking plants. And so they're already, stress, people, workers deciding if they're going to, get their medicine, right? Get their medicine or take a day off because their child has a cold, right? You have to decide that, either that or go to work. Now we have the pandemic and they're trying to decide, do I go to work and risk catching the virus? Do I stay home and then not be able to feed my family? And so, the pandemic just really exposed the illnesses in these industries that we were already facing.
Yeah, thank you. I mean, I think that's exactly right. It seems like the pandemic in so many areas of our economy, our legal system has been this enormous stress test, and it's pushing down, and we're seeing where the walls are cratering. And, of course, for today, what we're most concerned about is the workforce and where the walls are really falling down on people. So I think for this question, we'll go around and we'll do ladies first. So Aquilina, if you want to pick up on that.
Sure. Well, so I work with the Filipino Workers Center and low-wage Filipino workers, primarily domestic workers who are caregivers for elders in their homes or in small boarding care facilities. And I'm also with the National Domestic Workers Alliance and really representing nannies, home care workers, and house cleaners. And so even before this pandemic, we've faced a lot of issues as a whole sector. And some are just the same as other low wage workers. I mean, the lack of healthcare does not come with this job. There's very, very few workers who actually receive healthcare with this job. And these jobs are very low wage. We actually face a lot of wage theft in this industry. So So because it's so behind closed doors and not so regulated, we were excluded from a lot of the protections that other workers received back in the 1930s. We because we are excluded from a lot of these protections, then it causes all kinds of issues in terms of wages, in terms of kind of even what condition you're walking into, because anyone can be an employer, can become an employer at any moment. You know, there's not a lot of uniformity or even support for employers who are hiring domestic workers. So it's kind of the Wild West in what you get. Um, and and unfortunately, this job is also like has a lot of legacies from slavery, right? In terms of thinking that domestic workers are servants and not workers, right? With workers' rights. So commonly, we have workers who are working for $3 to $5 an hour with no overtime. That's a very common wage, and they're working around the clock. So it's very, very intensive. And a lot of times where they're working is where they're living as well. So that's another issue. Or where they're living is also very overpopulated and overcrowded, just as Robin had said, with a lot of their workers. And this is very much an immigrant worker job. And there are a lot of people of color in general, not just immigrants, but also a lot of domestic workers from the African American community, as well. And it's one of the fastest growing jobs. So just to say, when the pandemic hit, it just like really exposed a lot of the insecurity that the workers are facing, and especially with wages and just inconsistency. Like there's no support to figure out what is the right way to face this pandemic together, that we're all safe, right? That you're thinking both about the rights of the worker as well as the safety of everyone involved. So yes.
Yeah. Ken, do you want to play, I'm going to mix my sports metaphors because it's not my area and I don't know why I'm doing this, but cleanup on this, cleanup hitter.
Cleanup here, sure.
Bat cleanup. And I apologize, please don't mention it in the chats. I'm sorry I did it. And do you want to talk just kind of briefly about those biggest issues facing American workers, and then maybe briefly the causes, and then we'll get into much more specifics of people's day-to-day lives and protections that they have and protections that they don't have.
Sure. So some of the big issues that we've been facing are increasing inequality and stagnating wages for workers at the bottom and middle of the income distribution. And in California, about a third of the workforce are low-wage workers. And we have major disparities by race, ethnicity, and immigration status, as have been mentioned. And workers of color are much more likely to be in low-wage jobs. And all of this relates to or is connected to a big decline in workers' bargaining power. So what's causing that? Part of that is a decline in share of the workers who are in labor unions. We go back to the early 1970s, 1 in 4 private sector workers were in a union. Today, that's 1 in 16 nationally, private sector workers who are in a union. And that's in a large part because of outmoded labor laws that provide too little protection to workers and employers who have figured out ways to fight very hard to keep workers from being able to join a union, and labor laws that are based on bargaining in one enterprise or one shop versus setting standards at a sectoral level. And that becomes very important because of changes in the structure of work, where we've seen a real fissuring in what David Weil calls a fissuring in work. So that's outsourcing of jobs, use of temp agencies, use of franchises, and all of those separate who in the supply chain has the real power over wage setting and over conditions of work, and who's the employer. And then, of course, the most extreme example of that is what we see in the gig economy, where the gig companies claim there is no employer and that workers are self-employed, which means they have no basic labor or employment rights. And as we get into the discussion of what that means for COVID-19, that becomes very important around who's liable around issues like health and safety.
Yeah,
And do workers have access to things like paid sick leave?
yeah, I definitely want to get into this issue of liability, and it's going to be a huge legal topic coming up, of course. So one thing that I've been reading about, and people who, I want to change gears a little bit, and people who've tuned in have probably been reading about a little bit, is OSHA. And I've read a number of articles now, which are some iteration of the defanging of OSHA. So, Robin, maybe if it's okay, we'll go back to you first, which is, what's OSHA really designed to do? And for our audience, why is it being defanged or declawed or weakened?
Well, it's being weakened because of corporations, right? And always who's running the country, right? We even see the CDC regulations. We'll see one regulation list one week and then it changes. So I want to take meat packing right now. Let me take meat packing and food processing, because I know we've seen lately how plants had to close, right? Tyson's closed, Smithfield, had hundreds of workers that were tested positive. In the meatpacking industry, we have been fighting against line speeds for years, right? And so Ken will tell you, right? In a meatpacking or food processing plant, there is no social distancing, right? There is online work. So I cut one piece and you process this piece. So it's all line work. And so these workers are already working, under unsafe conditions when they have to do this work faster, right? And so there is more injury, health issues because we're so close together. And then I'm trying to speed up the work, right? And so those regulations have been slowly eroded, and we've been fighting for that. And so now OSHA continues to erode those because of corporations, right? As Ken said, who has the real power? And so unless workers are under a union contract where there is some, protection, better protections, right? We continue to fight not just for the unionized plants and workers, but for the industry, right? As all unions are doing right now. Wherever union workers are benefiting from that industry, it's because the unions that represent those industries are advocating for the workers in those industries. And so we've been fighting this for many years, and now that meatpacking plants have closed, not because some workers were tested positive, right? Not just because some workers were ill, but because some workers died. And so I was on today with a man from Indiana from the Tyson's plant. He was actually the whistleblower. And his coworkers were telling him that he was sick. They were sick. And he went to management several times. And they said, oh, they have a cold, we're going to test. And it didn't happen. So he had to go outside of the company, go to the union, and even go to the governor. After OSHA and CDC went in, 1,200 workers in that Tyson's plant was tested positive, 1,200 workers. And so they had to close the plant down, and the plant is now reopening. So now with the reopening of the plant and with the president, forcing the governors to keep meatpacking plants open. Now we saw over the last couple of weeks, we have seen these meatpacking workers getting ill and dying, and then have the president to force governors to keep those plants open, especially in these rural areas, right? To keep these plants open and then really not put strong regulations to protect them. And so workers are afraid. They are afraid to be at work. They know their coworker are coughing, and some of them are still going to work. Why? Because they are in fear of losing their jobs. Many of them are immigrants, right? And so they need to work, but they still are afraid that they may contract the virus, and then they may bring it home. You know, they're not just workers, they do live in our communities. So they have children and family and neighbors, and they go to the grocery store. And so now, they are exposing other people. So, the issue with OSHA and now CDC, it's all about power. It's all about who has the power. And corporations still have the power. As workers return to work, now corporations are saying, how are we protected from any worker trying to sue us if they come back to work? Because of course they want to make money. It's all about the dollar, right? And we want to make money too, because we want to feed our families. But how can we be protected that when they come back in the workplace, that we are not liable for them being ill? And so we understand in some of these plants, people are coming back and they are tested positive, but because they don't have symptoms, right? They're not ill, so they're letting them come back to work. And sometimes we think that, when they say, oh, well, the workers are going to be tested, that means that we're going to take your temperature, right? And if you don't have a temperature, then you can come in and go to work. And so, prior to COVID, we've had these issues, with OSHA and, other regulations. We have fewer inspectors on the line. We have fewer, USDA inspectors on the line. That's already dangerous in itself, not just to the workers, but to the consumers as well. So,
Yeah.
these issues were there, and sister.
Aquilina,
Yeah, I mean, I was just gonna say that, like, I think especially this pandemic has exposed just how essential so many different workers are, and just more how interconnected we all are. So, in terms of just like the run on food there's not really a food shortage, but then like, how much we rely on essential workers like meat packers, and then how actually putting them in such dangerous, unhealthy situations is one, so bad for the workers, but also so bad for our whole society. And I don't think that people realize why OSHA was created, right? And I don't think that folks remember like just how the level of accidents and death that used to happen in this country before we had more regulations and protections put into place, like OSHA, and like how many times factories would catch on fire and just like hundreds of workers would die, and until workers actually organized to protest all of the deaths. And immigrant workers, the shirtwaist workers who, protested the fires, were really some of the workers who, they brought to light the kind of corporate interest that the businesses had. They would lock and bolt the doors, the exit doors, because they didn't want workers to take breaks, or because they thought maybe they would be stealing. But so it's all about their corporate interests, but that then created this fire trap. And the organizing that happened then actually created a lot of the protections, or built the movement, like really led to the labor movement that helped to build in the labor protections that we have today. Those were really fought for. And that if we didn't have these kind of protections, we would see just the high rates of injuries, because corporations and businesses are not going to regulate themselves. They're going to move based on the bottom line, the dollar, right? Like Robin said. Right now, we're actually, as domestic workers, we're trying to fight for inclusion in Cal OSHA here in California, because a lot of domestic workers are still excluded from those protections. And, part of it was like we saw during the wildfires, for example, there were domestic workers that were being asked to stay on the premises to protect property and animals when the employers that would leave the area for their own safety. And after the fires, they were being asked to clean up toxic ashes and and debris from the wildfire with no kind of protective equipment or anything, and that was leading to respiratory diseases. And so, but still without any kind of health insurance, so we need to be able to have protection for all workers. And right now with caregivers, especially caring for some of the most vulnerable in our community right now, to this virus, elders in our community, you know, there are no protections right now. And even workers are finding it very difficult to find their own kind of protective equipment, so that they, like it's very, very hard for them to source and locate N95 masks, for example. And we've seen a large trend also of caregivers contracting, becoming positive, and then also, and we've had members just within Filipino Worker Center who have already passed away because of this, because of COVID as well. And then, one worker is working and they're living a lot of times because of the wages in houses, with other roommates, a lot of times for other care workers, right? And so they don't have any place to properly medical shelter. And so this is just, causing, we have one woman today who just tested positive. We were able to move her out of a crowded situation, but she's already positive. And so probably that whole house of caregivers is actually positive. And they need support around testing. They need support around treatment. They need support around actually having a space where they can medically shelter, and they also need paid time off so that they can actually do that. Actually, NDWA created a care fund so that, although it's not big enough, but the ability to have paid time off to actually take yourself out of work when you're sick is so crucial at this moment. Like you can see it with the meat packers, you can see it with all these essential workers not having sufficient paid time off to be able to actually shelter and care for themselves and care for and keep everyone safe.
Yeah. So I can already see that this is going to be an embarrassment of riches, and we're going to have so much information that I'll just be here making sure that we can cover some of the big topics. And the next frame I wanted to talk about is protections or lack thereof that we have for American workers. And this is a question I had, and I believe Perry already wrote in with it. And this is a question about health insurance. And the first question I had is, and Ken, maybe I'll start with you because I didn't go to you for the last one. Is America really an outlier in terms of how we provide people with health insurance? Obviously, by which I mean we tie health insurance to employment largely. And so is this typical? Are we an outlier? Is there a better way of doing it? Just a small question for you. 2 minutes.
We are very much an outlier in almost every other developed country in the world, and every other developed country in the world. There are forms of universal health care that are not directly tied to employment, or to the degree that they are tied to employment, there are clear avenues for people who do not have work. The United States is the only developed nation without a universal healthcare system. And what that means here is if you lose a job, you lose your healthcare. Now we have a safety net backup. People can end up on Medicaid or Medi-Cal in California, or go to the health insurance exchanges, Covered California here in California, and get care, but that comes at a cost, at a moment when people don't have resources. You can stay on your job-based coverage through COBRA, but that's insanely expensive. And so I think one of the things this crisis has done is really made clear how unfunctional our system is that ties our access to healthcare to our job. And just I should note that there was the history behind that, in the sense that the labor movement in the United States was fighting for universal healthcare, and employers resisted that because they believed that if workers received benefits on the job, that one, they would be more likely to stay in that job, and two, that gave employers more power. And so much of our safety net is delivered through the job in the United States, whereas elsewhere in the world, it is separated from.
Yeah. In terms of the health insurance that we see being offered right now, are there some specific fixes based on, so if you were either the president or the governor, what are two things that we could do with respect to health insurance, specifically during the time of COVID, that would help protect workers?
Well, there's some short-term, I'll just say there's some short-term things we can and should do. And California's already taken some steps in this direction. And one is making sure our safety net programs are available to everybody, regardless of immigration status. So
Yes.
Healthcare doesn't know any boundaries, or disease doesn't know any boundaries. We need to make, and as human beings, we should make sure everybody has access to healthcare, regardless of immigration status. That's first. Second, California has taken steps to provide its own subsidies in the health insurance exchange through Covered California, but much more could be done in that area. But third, I would just say one of the things that we need to do, and California is in this process, is to look in the long run of moving away from a system of insurance mainly coming through the job, to looking at how do we move to a universal healthcare system. And there are plenty of examples from around the world on how to do so, and it's different in different countries, but it is something that the United States overall needs to explore, and California as a state is exploring.
Yeah, I wanted to talk about a different type of insurance now. So we talked about health insurance and we touched on this, but unemployment insurance. And I'm going to ask you again, and maybe Aquilina, will start with you. You are president or you are governor. What protections should we be offering to workers right now during the time of a pandemic? And this is a question that I saw come up in the Q&A. It's a question that I've seen a lot in the news. What if I'm offered to come back, but I don't feel safe coming back? So I know that was a compound question, and it's not fair, but I'd love to start with you regardless.
Well, I think, one, there needs to be, there's a good move. I mean, I have to say it's good that it's been recognized that there should be pandemic unemployment insurance and include those who are self-employed, because we have such a problem of misclassifying workers and this gigifying of workers. So we really do need to include all workers in unemployment insurance. But with the question of coming back to work, if you don't feel safe coming back to work, one, I think that the unemployment insurance, it could be something where businesses are actually being made to step up to a certain requirement of safety and a certain kind of requirements of what they implement in their businesses to actually make for them to be able to ask their employees back, right? And that and if they don't meet those requirements, that workers have the right to stay unemployed, right, or to stay on unemployment insurance. We've seen in a lot of nursing homes and facilities that we've just had huge rampant numbers of positive cases, and not all of these facilities have really stepped up to what they need to do in terms of providing testing on a regular basis and testing for everyone, staff, clients, caregivers that are hired directly by families, and putting into practices like the providing the PPEs. So, it could be something where we're helping to get workplaces up to safety standards, and not just for the pandemic. I mean, I think that it would be great if we also had like task force, that workers were also involved in evaluating what makes their workplace safe and what needs to be improved, right? And that it also helps to build a voice for workers in that work site to be able to then advocate for those rights, because it's not going to be enough just to have them in place. It's also, how do you actually enforce it?
Yeah, and thank you. So this was a question from Robert, and he has another good question on this, which I'm sorry, I know you touched on it a little bit, but basically, what's the threshold for what you have to prove as a worker to say, I don't feel safe going back? We know from the employer side, maybe what they have to provide, but as a worker, do you have to, does it just depend on the employer? Do you have to say, I have a pre-existing condition? Do you have to say, show birth certificate to show you're a certain age? Robin, I believe we haven't heard from you in a while, or not in a while, but in the last kind of round robin. Do you want to take this one?
Yeah, so I think it depends on the employer, right? If you have a union, I would just say you should call your union. Workers still have rights. And so workers have rights to protest. First, take your right to protect yourself. So if you do not feel safe going back to work, then you should let your employer know. Let them know you do not feel safe. Like the sister just said, some people are going to stay on unemployment. And some people in these low wage jobs, they're probably making more in unemployment right now than they're making if they go back to work, especially if they are part-time. Don't know how many hours they're going to get per week anyway. But workers should let your employer know that you do not feel safe. I think we should be working with the governors, all of us as activists. I know a lot of the unions are working with the governors because there is no, universal plan coming from the White House. Then these states, they have an opportunity to create their own protections for their workforce and for their community. And so we should be talking to our council representatives. We're talking here, I live in Prince George's County, Maryland, and our county exec, although the governor said, we're going to reopen, the county exec said, no, we're not going to do it right now, right? And so we should be working with the elected officials. They do have power. And so workers can reach out directly to their elected official, reach out to your union rep, reach out to any organization or advocacy group. If you don't feel safe of talking and you're afraid of losing your job, reach out to an advocacy organization. There are many immigrant rights organizations that are advocating for workers right now. The NAACP is on it, throughout this country. But workers still have rights. They still have rights to organize, to speak as a group, to protect themselves on the job, to ask for the protection that they need for PPE. We need masks. I don't feel safe without going back to work and having sanitizer, hand sanitizer. I don't feel safe going to work and not having a mask, right? We need some social distancing, in meat packing plants and things like that. In the grocery stores, if there are more than 50 to 60 customers in a grocery store, that should be regulated. And if workers don't feel safe because, there are too many customers in that store, they should speak up. If you don't feel safe speaking up as yourself, then get a group. Speak up for yourself. Go out to a union. If you're not unionized, call the union. Tell them, I'm a grocery store worker. I'm a sanitation worker. Right now we have people that are shopping in grocery stores spitting on cashiers. You know,
Yeah.
I just got a call today that you know, some postal workers, people are out shooting them with the paintball guns. Postal workers, these workers are putting their lives on the line to serve us, to serve us. And so they should be, one, protecting themselves, organized as a group. The postal workers, they have a Facebook page. And every day I'm looking at what postal workers are talking about, right? If they're feeling safe, you know, I'm going to be off for 2 weeks because I have symptoms. If you don't feel safe, if you're not feeling well, tell your employer you cannot work. And then, as Ken talked about, we have these other illnesses, you know, healthcare insurance, sick leave. We are advocating in the state. We're doing it statewide. We're doing it countywide. We're doing it citywide. You know, that we need extended sick leave. We need family medical leave. If I have a grandmother that's sick with the virus right now, I may be her only way of healthcare provider, but I have to go to work. I should have that opportunity to take care of her right now. So I don't want workers to think that they don't have any rights. Workers do still have rights to speak up for yourselves and to speak up for your coworkers.
Yes, thank you. So I think it's going to be my job because we have a wealth of information here to, I'm going to have to keep the trains running a little bit. And so we got both from Connie in the chat and from Robert in the Q&A, the same question, Ken, which is, what about non-union workers? So I want to come back to the issue of union workers and unions in general. It looks like we accidentally started sharing the Q&A slide. My apologies. I referenced the Q&A. That was my fault. The Hammer team is always on it. I referenced the Q&A and there it was. Ken, could you talk to us a little bit more specifically about the law for non-union workers?
Well, so in general, to receive unemployment insurance, a worker needs to have lost their job or had a significant reduction in hours and be looking for work. With unemployment high, workers have few outside options. So if an employer reopens and offers a job back, workers are faced with an impossible choice of either going back to work in what they may consider unsafe working conditions or losing their job and both their job and their unemployment insurance. Now, California is very clear in its rules in terms of, you know, if you have a reason that you cannot go back to work because of COVID-19, you can continue to receive unemployment insurance. The question here is if the state says okay and rules in your favor, or the big thing here is, will the employer contest that? And I think in some cases, employers won't. And in some cases, employers are and do. I mean, we are seeing that in a number of cases. And so I think Robin is right that workers have rights, but we also, in general, for non-union workers in the United States, those rights are weak and they really depend on the state that you're in, the kind of rules that have been set up in that state and what kind of enforcement is happening there. And then we do have whole groups of workers like gig workers where the employers are acting as though they have no rights whatsoever and refusing, despite changes in California law, refusing to recognize any rights in these areas and simply contesting them all the way along.
And if you're undocumented, you cannot access unemployment insurance, none of the unemployment insurance.
Yeah, I want to spend a separate moment on undocumented workers and talk about the fact that the protections that we're discussing, many of them are not available to undocumented workers. And Ken, I want to stay with you for a moment because this is something we talking about yesterday, which is I want to move now from the quick discussion we had of workplace protections to talking about specifically different types of workers and what's happening to their lives right now. And so first I want to ask, what's our definition of essential workers? We've kind of been dancing around it a little bit, but who falls within this category? Is it just whoever we say it is? Is it whoever the governor says it is, whoever the president says it is? And who typically are these essential workers? I think we've heard a lot so far, lower wage workers, workers of color, but what else should we know before we start diving into each specific type?
Well, just to note that essential workers are the jobs that have been designated as, in this case, the governor said, these are jobs that need to remain open in this state or as in the various county orders because they're economically necessary or necessary for the well-being of the society as a whole. So we've decided that healthcare workers are essential, long-term care workers, home care workers, in some cases, childcare workers so that others can go to work, meat packing and retail workers, food retail workers. Whereas in other areas, we've decided, like in hotels and entertainment, we want those workers to stay home. And the reason that the unemployment insurance is higher for those workers is, at this point, as Robin mentioned, is we want to pay them to stay home because we are all safer if people can shelter in place. And as you noted, low wage workers are much more likely to be in frontline service jobs with a direct relationship to the public, much less likely to be able to work from home. And low wage workers and workers of color and immigrant workers are disproportionately in these frontline essential jobs. And so, as noted, because that workers have very little choice. If your employer is saying, if you're an essential job and your employer is saying you are needed, that unless there is another very direct relationship that workers can show they can't work because of COVID-19, workers don't have access to unemployment insurance. And as Columbia economist Suresh Naidu likened that to forced labor. And that is really one of the things that becomes very horrifying in the proposal in the Senate to remove any liability for companies whose negligence leads to the spread of COVID-19 on the job. Because
Could you talk about that for a minute? It's come up a few times in the Q&A, and I was going to bring it up later, but what specifically are we talking about when we say protecting employers from liability?
It means what Mitch McConnell would like to do and what is being proposed out of the Senate is to say that no business could be held liable for the spread of COVID-19 on the job. One of the reasons employers aren't opening back up, even where they have the option, and because we have a number of states that have opened things back up, is because they're afraid of being sued. Now, that actually is the whole point here of having negligence suits is if an employer is following all the rules, if they're opening up and providing people with the protective equipment that they need to do the job, if they're taking care of both the public and the workers, then they're not going to be found negligent in a lawsuit. Where this becomes dangerous is the signal it's sending is, we don't care what you do. It's more important that you produce the beef to get on our plates than it is that your workers don't get sick and don't have the possibility of dying. That is a very dangerous signal to be sending out.
Is there an argument, though, that we have to do something to protect employers? Not all employers are huge corporations, and employers employers are often small employers and have small businesses, the proverbial mom and pop businesses. And so we have to put the burden somewhere. And so there should be some protections in place for them so that we can get the economy basically open and moving, and that's in the end better for everybody.
The best protection for employers from legal liability is to follow the rules and to have a safe working place. And as Aki mentioned earlier in the discussion, we have a long history of very unsafe and dangerous working places when there aren't strict rules in place. And the right to sue is one part of creating those strict rules.
And then to support small businesses, I mean, the government could be doing things like providing them with PPEs, for example, to give to, I mean, I guess it's debatable because there has to be requirements around it. We don't want to subsidize businesses too much either. But, in this extraordinary time, it could be also providing some kind of supports like that, not actually rolling back liability, because we know, right? I mean, I think when I was on before with Naomi Klein here at a previous forum, there is this kind of disaster capitalism, like, that is trying to move back protections that we've fought for so long, that actually make everything safer and better and more stable for our country. So we need to make sure that we're not rolling back, these types of liabilities and protections that are there for a very good reason. And just doing that actually creates a more unsafe environment, and it's not going to let us be an open and free society able to roam about anymore. We actually have to tighten up, right? We need to actually have all of these regulations so that we can get past this pandemic. It doesn't happen just by wishing it so. We need these kinds of enforcements that will help us make work sites safe for everyone, safe for the consumers, safe for the workers, and I think this, like, with our, hopefully the community, like, can really come together in solidarity with workers who are advocating, for their own safety and the safety of their coworkers. That this is really the safety of us all, and that these protections, these regulations, are going to be good for us all, even for bringing the economy back online. These are all the things that we need to get in place in order for us to actually move forward.
And I hope the community remember the essential workers after this pandemic is over. I think a lot of retailers are going to take advantage of this opportunity, right? And go work, workerless, right? And so we have all kind of robots running grocery stores now. We have Amazon, and you can come in and purchase and never see a human person in there. And so I hope after this is over that the community will remember these essential workers, postal workers that are facing a deficit right now. Remember your your delivery person still worked through this pandemic. Remember the healthcare workers in hospitals, not just doctors and nurses, but we have the food handlers there. We have people that clean your room, clean the rooms. We have the technicians, and we have healthcare workers that are in nursing homes that are really facing dangerous conditions in these nursing homes. So I hope after this pandemic is over that we will remember who the essential workers are, in a pandemic, that they didn't call on the football players or the basketball players, not even the CEOs, right? They called on everyday workers that go to work and serve us. Most of these are service jobs that are still open. And so, we must continue to advocate for these workers. We see all these illnesses that are already in the system, right? And we need to work to make sure we have some type of universal health care, not erode what we already have. We need paid sick leave. We need health care insurance. We need unemployment for when people do get sick. And we need good wages. We need a livable wage. Now I'm saying a survival wage just to live in this country. But we need living wages. We shouldn't be advocating for Kroger workers to have $2 hazard pay that lasts for 3 months during the pandemic, right? And so I just hope that, this is not just a moment for these workers, that we will take this very seriously, that we have immigrant workers that have been serving us for many, many years in this country. It's not new that immigrant workers have been serving us, that we need to advocate. They need protections when we're in pandemics. They need to be eligible for unemployment insurance. And so, this is just a time I just think that we need to not just stop here when we're in a crisis. That is the crisis at the moment. we're going to go through another crisis, and we're going to
Yeah.
need these workers. And so, you know, I hope people that these workers are serving, that we will not forget them, you know, after this is over.
Yes, absolutely. Well, I see happily a very active Q&A. So I want to actually end pretty quickly. And I want to talk about the area that I know is really important to a lot of us, which is undocumented workers. And Aquilina, you've talked about this a little bit already. So maybe we can go to you just for a specific focus on this issue. And I know it seems obvious, but how are these workers in a particularly precarious position? And what are some steps that, meaning what protections are they lacking? And what are some steps we can take to protect them? I know some people use words like amnesty. So what's really on the table?
Mhm. Yes. I mean, just as Robin was talking, just adding to our list is we need to fix our unjust, inhumane immigration system. That if people knew how unfair it is, I think a lot of people would be even more in support of actually fixing it and having a pathway to citizenship for all of the immigrant workers and families that are here. So what at this time, so unemployment insurance, they're not eligible for any unemployment insurance. The stimulus relief, uh, they're not receiving the stimulus relief. And even families, mixed status families, a lot of them are not able to get it. So even like their citizens in that family, they're also not receiving that assistance. So what we're seeing right now, especially for example with the caregivers that we work with, because they're undocumented. First, they're dealing with a certain level of fear in their everyday lives already pre-pandemic, and now even with the pandemic going, ICE is still continuing their deportation, conducting different deportation operations. They have not stopped during this pandemic. In the detention centers, there's no way, they're so overcrowded. There's no way to social distance, and there are so many folks with a lot of underlying illnesses. You know, the corporations that actually run these detention centers, a lot of them are private and are making a lot of money in that industry. They've actually been advocating for a lot of policies that result in more immigrants in the detention centers. You know, so that's also a big just basic human rights issue, that people are being kept in very unsafe conditions. But as workers, so they're not getting unemployment, not getting stimulus, are not eligible for, a lot of times, even if they are eligible for paid time off or paid sick leave, which they are included in the laws here in California, they are in such vulnerable situations that they're not able to actually get it, right? So a lot of domestic workers are, because there are more people working from home, so maybe they're not needed, and because of the fear of or wanting to shelter and not have that contact, you know, there are a lot of domestic workers and housekeepers that are not actually, that were left unemployed, and there's no kind of paid sick leave or unemployment that they could access. So that's just some of the situation. And then we had workers who were sheltering in tents or in their cars because they have no place to go, and had no kind of financial assistance to be able to access other places to shelter, for example. And support around testing as well. So if you don't have a car, you're going on public transportation, which has been very unsafe. And even the testing here in California, a lot of it is drive-through. So if you don't have a car, sometimes it's very hard to access the testing as well.
All right. Well, we are getting to the point where people are going to want their drinks or dinners. And I want to get to these questions. And I also just want to remind people, if you want me to see it, please put it in the Q&A. I know the Hammer staff has been trying to move some chats over. Aquilina, there was a follow-up to what you were just saying, which is, please explain how unfair our immigration policies are. This is from Michael. Please compare to Mexico, Canada, others.
Mhm. Well, for our immigration system here, there is not like actually a line necessarily to get into, and everyone doesn't have like a path forward. There are only certain reasons that you can actually change your status. So there are like, no one really wants to be undocumented. And so a lot of times it's for lack of any kind of legal pathway forward to be able to change your status. Those who have money to invest in the United States, or those who are filling certain job positions, or if they're lucky enough to also have a family member, those are reasons that they might be able to come over. But for example, Philippines is one of those countries. If you're coming from the Philippines, we have some of the longest waits to come over, even if you have an approved petition. So like, even if you have an approved petition from certain categories of family members petitioning you, it can be up to 25 years or more. So, and this is similar for Mexico as well. And at certain times, if you had a citizen who was petitioning you versus a legal permanent resident, your time would actually be longer versus a legal permanent resident petitioning for you, for example. Also, a lot of the visas that are given that are work related really tie your immigration status to your employer, which then gives your employer a really outsized amount of power and control over that individual who has that visa. So for example, we have been seeing a huge amount of J1 visa workers who work in amusement parks, who work in factories like Hershey's, or in even like 5-star hotels, who are actually human trafficking victims because of what they're being coerced to do. They basically become indentured servants to work in these companies. They're tricked into accessing these visas by giving them a false impression of what they're actually getting into. And then they're held in very controlled situations. So, I mean, there's so much to say about the immigration system. I don't know if Ken, Robin, if you also want to jump in, but yeah, I mean, even if you're married to a U.S. citizen, it doesn't mean that you can actually change your status. And yeah, there's a lot to say, but.
Well, so I think I'm going to keep getting to the audience questions. Ken, I saw you want to weigh in briefly.
Well,
or...
I was going to weigh in on another one of the audience questions because I saw it came up a few times, but if you want to let you.
Please.
So there were several questions about, if my employer starts calling people back, do I have any rights to be, my place in that line, or can they just go and hire somebody else and I lose all of my seniority or accrued paid time and all of that? And in general, if you are in a non-union context where there are straight rules spelled out and you have been laid off and you no longer have an employment, your employer does not have a legal obligation to hire you back. The city of Los Angeles passed a right to recall law in this crisis that applies to hotel workers, retail workers, and building service workers. There are discussions about trying to do something broader. I know a number of other cities are considering right to recall laws, and there's been some discussion at the state level. But when we look at things that should be in place, that is one right that does not currently exist that would be very important in this context so that people don't lose all of the seniority and benefits that they've accrued and can get back on the job as quickly as possible. And also the key thing here is so that we're not in a situation where the person who raised their voice and pointed out the occupational health and safety violation is then the one who isn't recalled. So making sure that in the sense that we have that whistleblower protection is really important for health and safety at this point as well.
Great, thank you. Next from Alma, what recommendations do you have for safety professionals to support workers during COVID? And this can be for anybody.
Well, I think educating. I think to make sure that they're advocating that workers have PPE that they need, and advocating for that. And in states where safety protection workers are, if they're working with their elected officials and the governor, to make sure that the workplace have these PPEs and that they can do some education sessions. I think education, just like people have questions here, people don't know where to go to get their questions answered. And so I think safety professions, they can do that, right? To advocate and find ways for people to get PPE, not just in the workplace, but in communities. Work with the elected officials, get some legislation, help to get legislation in place. But the education and people having someone to call and just ask questions, I think is very important.
Yeah, for example, Dr. Robert Harrison from the University of San Francisco has been helping to provide us with some specific sessions for caregivers, because there are no trainings for caregivers of what are good safety practices, what is the up-to-date information about what we're learning about the virus, for example. So information and getting information to communities and workers who won't necessarily get it automatically, I think is key. Helping to get it in language also, we have to think about the different culture and accessibility of this information, and in different settings, what does that look like? I mean, even in our community center, we're trying to think about, so what does our operations, if once we're coming back online, what would that look like? So it could be working in partnership also with different sites to figure out kind of like what are the good safety practices. Together, encouraging the worker voice in helping to craft, and bringing together all of the science and research as well, but lifting up the worker voices also in the work sites.
Thank you. I want to make sure that we get to as many questions as possible. It looks like we got an iteration of this question a couple of times, which is for a non-union essential worker, the term qualified reason or unqualified reason was used. And so what specifically do we mean by that?
Ken, I think you mentioned
Ken,
I think you mentioned the qualified and the unqualified issue for not returning to work, right?
Right. So yeah. So if one just generally says, I don't feel safe returning to work, that's not enough. If you have, I am in, there's some very concrete reasons that I can document as to why my going back to work would create a danger, then you have a basis in that going into that case. So yeah, it is not enough to just have a general fear. There has to be something specifically related to COVID-19, in this case, that you can use to show why you're not able to return to work.
And I see one of the questions were, I'm 65 years old and I don't feel comfortable going back to work. And so I would say, talk to your healthcare provider. I would definitely be in contact. I had 2 Zoom calls. I've had a heart attack, and so I've talked to my cardiologist, by Zoom, and he just wanted to check in. And my primary doctor, right now I have some aches and some little chills. So tomorrow I'm going to call my primary doctor, tomorrow. But if you're 65 and you have some underlying whether you're 65 or not, if you have underlying conditions, if you're diabetic, if you have heart disease, and you don't feel comfortable, you should be talking to your healthcare provider and asking for, a release form or, some type of documentation so that you can give to your employer, especially if you're non-union, to give to your employer to say, one, I may be a high risk to my coworkers, right? And then 2, I don't feel safe, right? Because I've had underlying conditions. And I'm not safe with going to work right now.
And to just note, there are other options as well in California and elsewhere. We have people have access to short-term disability if there's a reason you can't go to work for health reasons. We have paid family leave in California in case you can't go back to work because you need to care for somebody else in your family. California has said that workers' compensation insurance cover if you became ill on the job. So unemployment insurance is definitely one direction, but there are other options and places that workers have. And EDD here has a fantastic website set up. The California Department of Labor has a fantastic website set up that really goes through all of those conditions and rights. Yeah, so I'd say look on the EDD website and really go into that in detail. And apply. I mean, don't assume you don't have rights. Just echoing Robin earlier, go in, apply for unemployment insurance if you think that you should have it. If your employer is contesting it, stay on it, because it is very important that you not just give up.
Right.
Yeah, and
I always say, California, you're so much ahead of most of the states, right? And so, I think most of the participants are probably from California, but, we're still working in some of these states to get all those, protections, right? And so that's why it's just important that, doing this and after this, that we can continue to get, some of the protections that we have in California and other states that are moving forward.
Yeah, I wanted to get to Elaine's question because I think this is a really valid question that we read about and hear about from our friends, which is, what about people who don't want to work because basically the unemployment benefits are higher? So they're making more money on unemployment than not. And, what do we do in that situation?
Mhm.
Ken,
Well,
I saw you start.
I just want to say something, which is the most important thing we can do right now to stop COVID-19 is that for those people who don't feel safe working, we should give them what they need to be able to not work. That is what's going to allow sheltering in place to work. That's what's going to allow the the infection rate to go down and for us to get the economy back going up. That should not be our major concern right now. And as noted, if somebody is healthy and does not have a specific COVID-19 related reason that they can't return to work, if they are offered a job, then they are no longer eligible for unemployment insurance. So I think this is sort of a false story that's going out there in terms of the way that's being looked at. But right now, we really should be doing what we can to enable those who shouldn't be returning to work not to return to work, and to keep our economy going, and the most important thing there is keeping money in workers' pockets.
And I think it could just be a sad statement on our minimum wage laws and our levels. Like, I mean, we need better wages actually, because we have not kept up with our standard of living. So, I think partly the way that it struck me was that it just helps to express that, right now, even if you're working full time, you don't necessarily have what you need to support your family and have decent housing and health care. So, and if unemployment is actually better than what you're making on your job, I think it's more of a statement on that we actually as a country need to do better to actually support working people to have livable wages. Yeah.
Yeah, I want to end with a question that came up a number of times, which is back to this issue of employer liability, because I think it touches on a couple of really important things, which is, allowing businesses to open, protecting workers. Where do we strike that balance? And so this is a question from Perry. Perry writes specifically first to Ken. Is it true that even if an employer provides PPE for employees and, quote, follows the rules, they can still be sued for negligence in contributing to the spread of the virus? The plaintiff might not be able to prevail in the lawsuit, but isn't it true that the time and cost of defending the lawsuit could actually sink a small business?
In any kind of policy, there's a trade-off. And in this case, we look at the history of industrial accidents, as Aki mentioned earlier, with the shirtwaist factory and fire up through history, and we can say we know what happens when there aren't rules and when there aren't mechanisms to enforce those rules. Then there is a trade-off on the other side where some businesses are going to face lawsuits that ultimately won't prevail because they weren't negligent, and that will come at a cost. And so that's the balance we end up with in order to have worker protections. I want to jump back to something earlier because someone around that question of what counts as a reason to be eligible for benefits. And the legal one is being sick or isolated as a result of COVID-19, unreasonable risk of exposure at the place of employment, caring for a family member who's sick or isolated as a result of 19, or caring for a child who's unable to attend school or a child care facility. So that is a fairly narrow set of rules, which I think is important to note because that came up a few times.
All right. Well, with that, we're well beyond the time limit that I had in my head. And I'm glad because, as I said, it's an embarrassment of riches when you have a panel like this and you have so many important things to share. I hope we provided some people with some global information on the state of American workers in our current economy, what has happened during COVID, what's happening to workers during a global pandemic, and the protections that are in place and the protections that should be in place. A lot of things that unfortunately we couldn't get to. We could do a couple of panels on this, but I want to sincerely thank you so much to all the panelists. And with that, my role is to say, Hammer Museum, please play us off.